Before proceeding with any sleep apnea procedure, it is critical to have a thorough and accurate assessment of your airway to understand your collapse pattern. Hi, I'm Dr. Jordan Weiner, a sleep surgeon. If you've been diagnosed with obstructive sleep apnea and have found that CPAP or other therapies aren't working for you, you may be exploring surgical options. Today, I'm going to discuss airway examination and drug-induced sleep endoscopy. I hope this video explains how we evaluate the airway to determine which procedure would be the most effective treatment. Obstructive sleep apnea occurs because the walls of the throat collapse, blocking the airway. This results in restricted airflow. However, not everyone with sleep apnea obstructs in the same location. Even the direction of collapse can be different. Some people have front-to-back collapse, others have side-to-side collapse, and some people have a circular collapse pattern. It's really important to understand the pattern and location of collapse so that I can plan a procedure that is tailored to your anatomy rather than a one-procedure-fits-all approach. To start this process, a detailed examination of the throat is performed in the office. During this examination, I look at the size, thickness, and position of the tongue, as well as the size of the tonsils if they are still present. I also look at the palate length and thickness. I determine the distance between the palate and the back wall of the throat, and I measure the internal width of the pharynx. This helps me understand an important dimension of the airway because a narrow pharynx is more likely to collapse in from the sides. Next, I perform an endoscopy through the nose to examine the airway from the inside. This helps me understand the relationships between the various structures of your throat. During the endoscopy, I also assess how much additional space behind the palate is created when you stick out your tongue. This mimics the effect of what Inspire and Genio will do. At this point, I have a good understanding of your airway anatomy. Next, we schedule a drug-induced sleep endoscopy, also known as DISE. This is performed with IV sedation in an outpatient surgery center. While you are asleep, the endoscopy is repeated. I watch the inside of your throat to see apneas as they happen. During the apneas, I can then see exactly where in the throat the collapse is occurring and in which direction. Sometimes there is collapse in more than one location. We divide the upper airway into 4 levels and describe the pattern and degree of collapse at each level. The highest level is the part of the airway at the level of the palate. We call this the velum. This is the most common site of collapse. At this level, collapse can occur both front to back, known as anterior-posterior collapse, as well as side-to-side, known as lateral collapse. If both anterior-posterior and lateral collapse combine, we can see a collapse pattern known as concentric collapse. This is a circular collapse pattern similar to the way a pupil constricts. The next level down is the level you can see at the back of the mouth. We call this the oropharynx. Here, we look for lateral collapse, meaning that the side walls come in. Further down, we look at collapse behind the back of the tongue, known as the tongue base. Collapse here is anterior-posterior or front to back. Finally, the lowest area of the throat is below the tongue base, but just above the voice box. Here, there's a flap of cartilage called the epiglottis that can fall backwards and close off the airway in an anterior-posterior dimension, but occasionally it can also fold in on itself. We use the acronym called the VOTE score to put it all together. V stands for velum, O stands for oropharynx, T stands for tongue base, and E stands for epiglottis. At each level, we describe the collapse as 0, 1, or 2, with 0 meaning no collapse, 1 meaning partial collapse, and 2 meaning complete collapse. As you might imagine, with 4 levels of the throat and multiple planes of collapse at 2 of them, this creates quite a few unique patterns of collapse. With moderate to severe sleep apnea, most people have multi-level collapse. Finally, using the knowledge of your anatomy from the office examination, combined with the VOTE score from the DISE, I am able to recommend specific procedures to treat your sleep apnea. For more information about CPAP alternatives and my practice, please go to weinersleepsurgery.com.